We are going to continue now with the management of sickle cell disease. So for the management of sickle cell disease, we're still going to use the sickle cell, the algorithm. For the algorithm, you have to manage the sickle cell. Then we manage the cause, the precipitating factor, you manage the complication, then you manage the background and the prognosis. Now we need to know that what we start with the disease, that is sickle cell anemia. Sickle cell anemia, you have to know that sickle cell disease is not managed by itself. The management of the disease of sickle cell, you need to know that sickle cell is a chronic disease, so it is not managed. It is the complication which is being managed. Are you understanding? So sickle cell disease by himself is not managed. The complication is being managed. So now, how do you manage a patient that has sickle cell? Generally, you have to manage a complication. So if a patient presents with, they generally present with acute complication, and the acute complication are going to be vaso-occlusive crisis. So if you have vaso-occlusive crisis, you need to know that one, you can manage that patient, you can manage vaso-occlusive crisis with a pain medication. You use pain medication by following the ladder scale. You follow the ladder scale, the WHO ladder for pain. When you have mild pain, you just use acetaminophen like paracetamol. Acetaminophen and paracetamol. When you have moderate pain, use non-steroidal anti-inflammatory drugs, and when you have severe pain, is now when you use morphine-like agents like tramadol, and you have alpha-fentanyls. So that's for vaso-occlusive crisis. Now the next thing after the vaso-occlusive crisis, we can have also sequestration crisis. When you have sequestration crisis, it's a surgical emergency. Sequestration crisis is a surgical emergency to evaluate for a splenectomy or not, because all the blood can pull into the spleen. To evaluate for a splenectomy, and you have also to evaluate for antithrombotic drugs. You have to give antithrombotic drugs to prevent from that viscosity, to reduce that viscosity of the blood. So for this sequestration, you evaluate for surgery for a splenectomy to prevent the whole pool of blood inside the spleen, and you have to evaluate for antithrombotic drugs such as antiplatelets, like the anticoagulant medications. So we have different antiplatelets, we have anticoagulants. In the case of the anticoagulants, you have the three types that we are going to do in heart diseases. Oral and anticoagulants, we have antivitamin K, and we have heparins. So, and you can also use for fibrinolytics. So those are the different elements that you have to evaluate for sequestration crisis. When you have hemolytic crisis and aplastic anemia, generally the first line that you have to do is to give a patient, when you have hemolytic crisis, generally you have to give the patient blood. So you give the patient blood, and then you have to give also vitamin B12, add vitamin B12 and vitamin B9, add the therapeutic dose, because you need to know that what we have a dosage that we give in children in the non-therapeutic dose, and we have also the therapeutic dose that we give to the children. The non-therapeutic dose is 0.4 milligram per day. But there is a therapeutic dose that you need to know, that in cases where the children have aplastic or hemolytic crisis, we now give them their therapeutic dose. Now, after that, we have the aplastic anemia. For aplastic anemia, you have to replenish blood to the patient, replenish white blood cells, replenish blood to the patient. And when you replenish blood to the patient, you can also give an addition of a you give a colony stimulating factor, for the myeloid pathway. You give a myeloid colony stimulating factor, and you have to also give a patient antibiotic to prevent from infections. Because white blood cells are going to be reduced. Since white blood cells are reduced, you need to give the colony stimulating factor, so you stimulate the bone marrow for its production, and you give antibiotic to prevent from infections. The next thing is, since the red blood cells are reduced, you have to give the patient blood transfusion, and you have also to stimulate the bone marrow for its production by giving still the myeloid colony stimulating factor and even vitamin B12. basically. And then the last one is, since the thrombocytes are reduced, you can also transfuse the patient whole blood or or the cases of cryoprecipitate containing thrombocytes, basically. So, or you give, sorry, fresh frozen plasma containing thrombocytes, basically. You transfuse the patient fresh frozen plasma containing thrombocytes, or you still give the patient vitamin B12 that's going to increase the proliferation. So that is going to be in a case of a anaplastic anemia, basically. The next one after that, so you can also give a drug for the management of parvovirus B19. The next one after that is to manage for the chronic complication. But the chronic complication, you are going to, their management is seen in their respective diseases. We are not going to speak about that. So after managing the complication of the sickle cell, you need to know that you have to manage the precipitating factors. Basically, you need to manage the precipitating factors effectively. Basically, what are the precipitating factors? You can have hypoxia. Basically, when you have a patient that has hypoxia, you have to manage the etiology of the hypoxia. Is it acute pneumonia? You treat the infection that is resulting to the acute pneumonia, basically, and you give oxygen to the patient, basically. So you give oxygen to the patient, oxygenotherapy. If there is acute asthmatic crash, you have to do bronchodilation, basically. So those are the different elements that you have to evaluate in the patient. So those are the precipitating factors in a case of the precipitating factors in a case of or in a case of that. So after that, so that's for hypoxemia, basically. This next precipitating factor is in a case of hyperthermia. So when you have hyperthermia, you have to give antipyretics to the patient, basically. If hyperthermia is a precipitating factor, you have to give antipyretics, basically. And the dosage of paracetamol that we give in the children is paracetamol, basically. Paracetamol 60 milligram. You give paracetamol 6